Ready.
Dr. Diez, you mentioned about crowns, bridges actually, and that sometimes cleaning the bridges might be a slight problem and create periodontal disease if people do that. Now, because of that, going right and straight to periodontal disease. And here's what I have noticed, Dr. Diez, and you go and straighten me out if I'm way off here at the end. I have noticed that most dentists, when they talk about periodontal disease and the danger of periodontal disease to their patients, that they talk about the losing the teeth, the loss of teeth, and how bad that is. Now, while I'm very sure it is a bad thing, and you mentioned how as you slowly lose teeth, you're shifting out of teeth. You have mentioned in other videos the great and bad effect of when you lose teeth, that your jaw bones are shrinking, and then you get this caved-in, dried-out tomato look, and it's just not good. And of course, it costs money to put teeth back in. However, at the very least, with money, you guys doing a great job. Even dentures these days are not necessarily that bad looking anymore. They're doing a pretty good job. So that can be fixed. We're not dealing anymore with a wooden tooth like George Washington apparently had. I don't know. So that said, however, while a person is accumulating this problem, years, 2, 3, 6 years, whatever it may take to lose the teeth, for them to be lost or they taken out, he's poisoning his body. He has an infection in his mouth, as what you called in another video, the gateway to the body. I mean, take salt, take anything under the tongue, and it goes into the blood vessels like crazy. So, wouldn't the infection in that mouth go into the blood vessels also? Isn't it true that babies are getting born premature and underweight for women who have a gum disease while being pregnant? Isn't it true that kidney, liver, and liver failure come out? Isn't it true that heart attacks and strokes are occurring? So if all these bad things are happening, those are really extreme and bad things. Wouldn't it be poisoning the body on a daily basis for your immune system, your fatigue, your, the next flu season, which is surely going to come, whether it's a swine flu, bird flu, or just the winter flu? Tell me, how far off am I that is the real danger? Never mind losing the teeth, which is, of course, bad enough.
You're dead on. Just sometimes I think it's hard for people to grasp that or to understand that. It's definitely linked to heart disease. It's linked to diabetes. It's actually been linked to not just low weight babies, but they've actually linked it to stillborn babies in certain cases.
There was a case in California not too long time ago.
Yeah.
They found the gum disease, that yellow ugly pus, that yellow ugly stuff. They found it in the placenta of the woman. Yeah, you're right.
Yeah, it's really scary. But helmet, I mean, you hit the nail on the head. Periodontal disease, gum disease, any infection in your mouth has an effect on your entire body.
So we're now at a point where not only can a dentist avoid maybe headaches and muscle pains, which in itself are a killer for a lifestyle, you understand? Can make you look better because the fallen in teeth, the shrunken jaw bones make you looking old and ugly like our grandparents did all look, So you become a cosmetic surgeon, you become a regular doctor. Now you can avoid literally, at least help to avoid, diabetes, So basically, it almost looks like a dentist should be the first person to be visited, period. And yes, frankly, I have also heard, tell me whether that is true, there are currently seems to be more and more surgeons coming on board where the slightest surgery, appendix here or hip operation there, I'm not saying a hip operation is a slight surgery, but it's getting there. But anyway, any type of surgery, that the surgeon will say, give me a clean bill of health from your dentist and gum disease, because if you don't, you've got to
That's
fix
right.
that. I'm not going to operate on you, because the body is so under stress already with your gum disease that if I cut in it, which every surgery is an invasion in the body, he might not stand it, and we now might develop something even bigger only because we have a body whose immune system is down. Is that true too?
That's exactly right, and I think that's proof in itself that the physicians now are demanding a clean bill of health, clean bill of oral health before they'll do surgery. I mean, that tells you a lot right there. So that says it all. The mouth has to be healthy. If your mouth is not healthy, you cannot expect the rest of your body to be healthy.
Right. I mean, as you said, there you have this open wound. Some people say that a gum disease wound in the mouth can be as big as your hand. Open wound. Now, most of us run to the doctor when we have a little, tiny half-an-inch wound on our hand or foot when it doesn't heal, as we should. But here we have a big thing and we go nowhere with it,
Well, it always amazes me how you can have pus in your mouth or bleeding gums and people will tolerate that. But if you're bleeding somewhere in your arm or your leg or any other part of your body, or you have pus draining and it won't go away, like you said, most people are going to run to the doctor.
As they should.
Yeah, and you bet they should. They have an infection.
Right.
And like most people know, most of the time the infection, it gets into the bloodstream and it travels throughout the body.
Right.
It's not localized to one spot.
Right, so not only does it go into the bloodstream, but I'm just imagining here, you eat this great steak with, potato gratin and cheese on it, and it gets mixed up with this thing. So not only does it go into the bloodstream while you eat or not eat, but then it's mixed up with your food, going in your stomach and going from, it's almost like viral marketing, I would love to be able to be a good, let's distribute the videos all over the place. I mean, those little germs get really distributed beautifully from all corners, don't they?
They sure do. They sure do.
Okay. Well, we're going to talk more about obviously what we can do, which I guess the simplest thing is clean brush and go regularly to the dentist, so that if he needs to cut it out, he cuts it out. But we're going to talk more about the advances in gum surgeries and periodontal surgeries, which I heard are fantastic. They're overwhelmingly great. All right.
Yeah.
Thank you very much.
Thank you.